The Medical Rehabilitation Therapist Board of Nigeria has organized a sensitization walk in Lagos to commemorate the International Day of People Living with Disabilities. Now joining us in the studio to discuss this is Olufunke Akonle, Registrar, Medical Rehabilitation Therapist Board on People Living with Disabilities. Good to have you with us on TVC News Hour Nigeria.
Good afternoon.
Yeah, so how has it been trying to rehabilitate people, disabled people in the midst of dwindling resources?
Well, it has been very, very challenging. There are a lot of challenges that we face in Nigeria when it comes to rehabilitating patients with disabilities, and more importantly, some of the disabling conditions. Now, let me just quickly introduce what we mean by medical rehabilitation, because many people don't know about them, about us in Nigeria. Now, Medical Rehabilitation Therapists Board of Nigeria is a regulatory body established by Decree 38 of 1988 to regulate and control the training and the practice of 7 professions in Nigeria. These professions are physiotherapy, occupational therapy, speech therapy, audiology, orthotics and prosthetics, chiropractic medicine, and osteopathic medicine. These are the professions that are responsible for rehabilitation of patients from disabling condition or for those that have sustained one disability or the other. Now, some of the challenges faced in rehabilitating patients with disabilities are, number 1, lack of facilities. Take, for example, in Nigeria right now, we have only few institutions, both tertiary, secondary, and the primary institution, where we have the services of physiotherapy, occupational therapists in Nigeria. Secondly, we have manpower. There's lack of manpower. In Nigeria now, like our board, we have only been able to register about 4,000 physiotherapists and occupational therapists, and looking at the nation of about 160 million. So there is, if you look at patient physiotherapist ratio, it's very, very, I mean, we can't even calculate it. We can't talk about that. Very, very low. And most of the physiotherapists we have produced in Nigeria, of course, they've gone out there seeking for greener pasture. So we're having a serious brain drainage when it comes to physiotherapy. Now, in occupational therapy, we only have 2 institutions in Nigeria where they offer occupational therapy, while we have only 7 in the whole of Nigeria. And I can assure you that any college of medicine in Nigeria, we can have a physiotherapy program running in them. So that's number 2. Then number 3 is socio-cultural factors. When you talk about socio-cultural factors, anybody that suffers any disability, we look at it maybe as a result of girls, that they have to appeal to some girls. So they don't seek medical attention as at when due, until when the disability is established. But if they have sought for these services earlier on, there's tendency for those with disability issues to be reduced. So what we are advocating for, number 1, is to make rehabilitation centers available in almost all the states of the Federation. Number 2 is to ensure that the available ones, they have the manpower to man or to carry out the services in those places, because it is very, very important. And we need to take rehabilitation to the grassroots. So there are quite a number of factors. And of course, funding is also one of the factors, and lack of awareness. A lot of people, even though they sustain this disability, they don't know where to go for the services. So we want people to know that these are the services that are available, that you can seek when you have any form of disability or the other.
All right, you've given us a picture of how things are, but let me ask about those who have succeeded in being rehabilitated. Yes. How are they faring? How useful have they been?
Oh, it's been fantastic. It's been fantastic because rehabilitation itself is a process of restoring an individual from a disabling condition to as much normal as possible. Take, for example, a stroke patient. When a patient sustains stroke, there's tendency to have the paralysis of one side of the body. And when that happens, when you get to the hospital, the BP, if it is high blood pressure, will be controlled. The sugar level, if it is diabetes, will be controlled. But the paralysis that this individual sustained, there's a need for a physiotherapist to come into action, to swing into action as soon as possible. And I personally, I can testify, we have seen series of individual conditions, cases like that they have been able to recover, that you will not even have any traces of this disability. But those that did not seek attention of rehabilitation professionals, they definitely sustain a lot of disability. So they do go back to their job. And it's also part of the rehabilitation to also give them, you know, to look at alternate job they can go into to still make them live as much independent life as possible, and at the same time integrate them to the society.
All right, at this point, we'd like to thank you, Olufunke Akonle, Registrar, Medical Rehabilitation Therapist Board on People Living with Disabilities. Thanks a lot for your time on
Thank you
TVC
very
News
much.
Nigeria.
Thank you very
Thank
much.
you.
All right.
All right, we'll take a short break and be back with more stories. Stay with us.